Okay, good afternoon all. So we'll go ahead and start now. And just a quick heads up, I have updated your scores for everything that was turned in so far, other than the final lab grades, of course, that need to be put in. So I'm continuing to receive your work along with your emails. So please continue doing that. And hopefully before the semester winds up, I will be going ahead and putting those grades in too. Case studies, something else to remember, your lecture quizzes on Connect, and what else are we left with? And then, of course, the final three uh, exams that I've been talking about, and you have the study guides for all of those. Extra credit, some of you were working on that as well. So please make sure you have the deadlines in mind and that you're able to turn everything in before that. So for the most part, that means by the evening of June the 30th, that would be this coming Wednesday, I should have everything in front of me. And so then the only thing that will be updated on Thursday is your comprehensive exam, okay? All right, so after those reminders, we shall go ahead and get done with chapter 15, hopefully today. And this one has to do with your autonomic nervous system. And as you remember, we talked about the CNS, or the central nervous system, being composed of your brain and your spinal cord, and it arises from the ectoderm, one of the three primary germ layers, right, in the embryo. And then, of course, the PNS, which stands for the peripheral nervous system, that includes 12 pairs of cranial nerves that we talked about before, and 31 pairs of spinal nerves. Here we have the autonomic nervous system in front of us, and it's called that because, of course, this works at an autonomic, self-modulating, self-regulating, unconscious, subconscious level. Much of this has to do with your brain stem, all right, and your limbic system, which is the emotional part of the brain, not something that we are consciously aware of, your visceral functions. So that's what we are looking at here. So the somatic nervous system is consciously perceived. For example, your ability to control your muscles, direct your voluntary motor actions, all of those are functions of the somatic nervous system, as you see here. Your five senses, vision, hearing, equilibrium, smell, and taste, as we see, again, they comprise the somatic sensory nervous system, okay, what you're consciously aware of. And your somatic motor system has to do with the movements of the skeletal muscles. So all of that is here. And so here's an example, and we looked at this earlier as well, of how the somatic nervous system works. Here's the spinal cord. Again, remember the gray matter in the middle, white matter on the sides and on the outwards. And then, of course, you have the anterior horn containing the motor fibers, posterior horn containing the sensory fibers, and then you have the lateral horns, which have the autonomic cell bodies, autonomic nervous system in these lateral horns here. So you see the posterior root ganglion that carries the sensory nerves, and then the anterior one that carries motor nerves, right? We talked about that as well. So these nerves are going to supply your skeletal muscles, as we see here, now as well, and the sensations are being picked up by your skin. So this is the sensory input, and here is the motor output based on that. All right, so the classical somatic nervous system setup, as you see here. Autonomic nervous system, or also called the visceral motor nervous system. Visceral because it controls your viscera or your organs, uh, heart, smooth muscle, glands, all right? And uh, it's always active without you actually knowing it, right? And some of the things that it does to maintain homeostasis is like regulate your blood pressure. So if I were to ask Eddie, if you right now tell me the exact reading on your blood pressure right now, most of us won't be able to. We might be able to give you a very close range, right? Which might turn out to be quite accurate based on our previous readings that we have had, right? Uh, but still, nobody can keep track of our day-to-day or minute-to-minute rather fluctuations in body temperature and blood pressure and those kinds of things. So that's the job of the autonomic nervous system, okay? So here is what that autonomic nervous system looks like. Here's your autonomic ganglion. It comes from the lateral horn. Again, you can see it here in this picture. The ganglion is simply a cell body of the autonomic nerve, okay? So then it transmits this message down here to your viscera. And in this case, these are the lungs, as you can see, okay? Well, this is the sensory part. So, for example, if your lungs are stretching because you're inhaling, taking air in, that is detected by the visceral sensory neurons, which carry this information to the through the posterior root into the lateral horn of your spinal cord. And then your spinal cord responds by sending out signals through the autonomic motor neurons here. And they might tell your lungs to slow down or speed up, all right, depending on whatever the feedback is. Uh, and it's all there to maintain homeostasis or negative feedback. So if you're breathing too fast, it will aim to bring the breathing respiratory rate down. And if you're breathing too slow, then the end result would be to increase your respiratory rate, right? So again, we are looking at negative feedback. All right, so let's go ahead and take a look at these two types of neurons that you will see in the autonomic nervous system, right? The lower motor neurons. And remember, we talked about upper and lower motor neurons, even with our somatic nervous system, right? The upper motor neurons were situated here in the brain or the brain stem, while the lower motor neurons were either in your spinal cord or in the skeletal muscles, all right, in the effector organs. Okay, so here is an example of an autonomic nervous system, lower motor neuron, as you can see here, okay? So this nerve extends from the spinal cord all the way to your autonomic ganglion. Okay, think of the ganglion as a railway station, a train station, or a uh, even a post office. Okay, so it's a temporary stop and processing point that you have here. So this length of the nerve all the way from the spinal cord to the autonomic ganglion is called the preganglionic cell body. Preganglionic because of course it's before the ganglion, right? And then after processing and getting some rest here, the journey continues via a post-ganglionic axon, as you see here, and that makes sense because this ganglion is going um, afterwards, right? It continues onwards from the ganglion to the effector organ, which seems to be your intestine here in this picture. Now, how does the preganglionic axon communicate with the postganglionic axon? By means of a neurotransmitter, which is going to be acetylcholine. Here, you can see acetylcholine being secreted, right? How is the postganglionic axon then going to communicate with your end organs, the target organs here, such as the intestine? So here you have you have a choice. You might either use acetylcholine or you may use norepinephrine or adrenaline. Okay, so here, depending on whether you're talking about the parasympathetic nervous system or the sympathetic nervous system, and we'll talk about those in more detail as well. Uh, the type of neurotransmitter can vary at this end. But here in the preganglionic region, in the ganglion, it is always going to be acetylcholine. That doesn't change. All right, so this is a picture that's telling you the connection between your autonomic nervous system functions and your higher brain centers and how they all work together. So your autonomic nervous system, for the most part, is located here in your brainstem and the spinal cord, right? We mentioned it before. Things like defecation and urination, erection, ejaculation. We talked about my construction worker patient, if you remember, from downtown Chicago area, and what happened to him, the guy who suffered a feet first fall and then developed a spinal concussion or a spinal shock, right? Uh, so these areas are involved there, the brainstem and the spinal cord. But then again, never underestimate the importance of the 4Fs organ, the one that we talked about earlier as well, hypothalamus right over here. And the hypothalamus is basically the command center for all of these autonomic functions, okay? So it is the mediator in between your endocrine and your nervous systems. So what criterion is used to organize the nervous system into the somatic nervous system and the autonomic nervous system? Somatic nervous system is under your conscious perception and control. Autonomic nervous system works at a subconscious level. What sensory and motor components are associated with each of the two systems? You have uh, the sensory, somatic sensory nervous system or the autonomic sensory nervous system. And then you also have the motor somatic nervous system or the motor autonomic nervous system. What are the anatomic features that distinguish the motor neurons in the somatic nervous system and the autonomic nervous system? In the somatic nervous system, you have a upper motor neuron and a lower motor neuron that we talked about. In the autonomic nervous system, you have a preganglionic axon and a postganglionic axon, as we saw in the picture again. What CNS structure is the integration and command center for autonomic function, that would be your hypothalamus. We just saw that in the pictures. Okay, so here we're looking at the two types of autonomic nervous systems, parasympathetic and sympathetic. So one way to remember which is which is, if you look at the word parasympathetic, right, starts with the letter P, okay, and parasympathetic. And so you can think of that P as being for peaceful or peace or peaceful, right? So in other words, when you are relaxed, in a relaxed state, physiologically relaxed state, your heart rate is low, your blood pressure is calm, your respiratory rate is at a baseline level, such as when you're sleeping or in a like a meditative mode, relaxing mode, that is when your parasympathetic nervous system is acting. So it's called, therefore, the rest and digest system, as you can see here. That is when you're replenishing your energy, regenerating your ATP, right? Rest and sleep stage, basically. So how about the sympathetic division? So again, the word sympathetic starts out with the letter S, and you can think of that S as also representing stressed, right, with an S, or scared, stressed slash scared, right? Um, so that's where the sympathetic nervous system is. So that is when you are faced with a critical situation, you are under stress, in a fight or flight response. That's what it's called. Like it says here, for exercise, excitement, or emergency, that's when your sympathetic nervous system comes into play. Okay. And in this very helpful illustration, you can see the difference in between those two. So the parasympathetic nervous system is depicted on our left-hand side in orange. The sympathetic nervous system is depicted on the right-hand side in purple. Okay, first up, what you see is that your parasympathetic nervous system is located or concentrated mainly in the cranial region here by the head, and in the sacral region. So the craniosacral, those are the two regions where your parasympathetic neurons are basically concentrated in the spinal cord. How about the sympathetic nervous system? In the thoracic region, and in the abdominal region or lumbar region, right? So in the thoracolumbar region is where you have your sympathetic ganglions or nerves concentrated at. So that's the first thing to remember, okay? So again, what is the function of the parasympathetic nervous system? Rest and digest, peaceful activities. So rest, that's what you're looking at here, okay? So what are the nerves that are involved with these rest and digest activities? First up, your oculomotor nerve, cranial nerve number 3, your facial nerve, cranial nerve number 7, glossopharyngeal, cranial nerve number 9, and vagus, cranial nerve number 10. These are primarily parasympathetic nerves. They are activated when you are in a rest and digest stage, okay? So how about the sympathetic nervous system now, the fight or flight one? So this basically has to do with what are called the sympathetic trunk. So it's a network of ganglions and nerves and neurons that are involved with this. And remember, the sympathetic nervous system is by far the more dominant one, okay? Not the parasympathetic division. So what does that tell you? Our bodies basically evolved for survival and sustaining the species, right? So more of a fight or flight situation, right? Excitement situation. Uh, but there's some rest and digest situations there as well, not quite as overwhelming and as dominant as the sympathetic division. So an interesting observation that you can see here. It increases alertness and metabolic activities, your sympathetic division, that is. All right, so at the bottom, you're looking at a structural or anatomical difference between the parasympathetic neurons and the sympathetic ones. What's the difference? Take a look. If you see the parasympathetic division, look at the length of the preganglionic axon, quite long. From the preganglionic neuron all the way to the ganglion, it's quite a long distance. So therefore, uh, these are long preganglionic axons. Now, how long is the post-ganglionic axon in green? Not that long, okay? All right, so that's your parasympathetic division. What does your sympathetic division look like now? Look at the length of the preganglionic axon up till the ganglion, not too long, it's kind of short. Now look at the length of the postganglionic neuron from the ganglion till the end target organ, it's quite long. The exact opposite of what you saw in the parasympathetic division. So that's another feature that you see. What does not change between the two, sympathetic and parasympathetic divisions? Look at the neurotransmitter in the ganglion. It's going to be acetylcholine for both. Acetylcholine is the neurotransmitter for both parasympathetic and sympathetic divisions within the ganglion. Okay, so that stays the same. So here we are looking at something called mass activation. Even the term tells you what it's about, right? Mass activation means when you are excited or scared or aroused or in any emotionally volatile situation, your sympathetic, your fight or flight nervous system, it fires all together. It's a mass activation. Your pupils dilate thanks to your what? The ocular muscles, right? Your pupils dilating, the dilator pupillae muscle that contracts and causes it. Your mouth goes dry because the saliva secretion dries up. Your eyes go dry because the tears dry up. Your heart rate picks up. You go into tachycardia. Your lungs start breathing faster, right? Your lungs dilate, bronchodilation. Your digestive activities slow down. Your urinary activities slow down, right? More blood is diverted away from your skin to your skeletal muscles. In other words, you're ready to fight or flight, right? And your hair stand on end like in goosebumps. That is an example of mass activation. All the systems throughout your body are activated there. So, and that's why what I was saying earlier about your sympathetic nervous system being more dominant, because life mostly cares about your sustenance and your survival, not so much about you listening to Mozart and relaxing in your bubble bath tub, even though you need that to replenish your nutrients. But mostly life is about keeping you alive in dangerous situations, right? That's how living things evolved. That's how living things continue to evolve, by coming across challenges and conquering them. So, and that is very much reflected in our anatomy and physiology as well, right? It's about mass activation of the sympathetic nervous system. So the parasympathetic division is responsible for what main functions? Rest and digest. Just remember that. Peaceful. Describe the general anatomic differences in the parasympathetic and sympathetic divisions. Parasympathetic neurons are primarily concentrated in your craniosacral region. Sympathetic ones are located in your thoracolumbar regions. Uh, Also, the parasympathetic neurons have a longer preganglionic axon and a shorter postganglionic axon. In the sympathetic division, it's the exact opposite. The preganglionic axon is shorter, the postganglionic axon is much longer, right? Uh, Rather the opposite. Uh, uh, so you get the point. Go back and take a look at the slide. What is the difference between the degrees of response for the parasympathetic and the sympathetic division? You see mass activation for the sympathetic division. It's much more overwhelming and spread out as compared to the parasympathetic division. All right, so these are the four nerves that are parasympathetic, rest and digest nerves. Number one, oculomotor nerve, nerve number three, as you can see. What does it do? So what happens to your pupils when you're resting and digesting? They constrict. You're in a relaxed state, the oculomotor nerve relaxes, and that is a function of the what? Of the oculomotor nerve, right? Uh, some drugs can do it too. So if someone comes to an ER, is in a, like a semi-comatose condition, reflexes are low, hyporeflexia, pupils are constricted, think of drug overdoses as well. And what drugs are you thinking here? Opioids, of course, right? And as I mentioned before, opioid overdose is the leading cause of death among people between 15 to 45 years of age at present. Uh, so constricted pupils, it would be an important corroborative sign here, right? Okay, all right. Facial nerve, cranial nerve number 7. What does that do? It causes saliva to be secreted from your salivary glands. That's what you're looking at, because rest and digest. So your saliva production picks up. Glossopharyngeal nerve again, saliva, salivary secretion. It primarily controls the parotid salivary gland, which is the largest of the salivary glands here. Uh, and so that's what happens with that one. Vagus nerve, cranial nerve number 10, very important. This nerve supplies all of your viscera, all of your organs, including the heart. So when the vagus nerve is activated, your heart rate goes down. Rest and digest. So calming effect, right? Vagus nerve causes your heart rate to decrease. Now that brings to mind quite an intriguing, a tragic but intriguing case to mind nonetheless. So this happened a few years back in New York uh, by the Hudson River, right? Hudson River banks uh, in New York City. And this involved a teenaged couple. Okay, so what happened in this case was, so this young couple, a boy and a girl, they were sitting on a bench by the Hudson River, right? And they were doing what teenagers all over the world do uh, at that stage, right? So they were kind of intimate with each other, and they were kind of petting. And so somewhere during this foreplay stage, the boy playfully pinched the girl's neck, the back of the neck over here, right? He was caressing it, and then he pinched. And the next thing he sees is that the girl just kind of slumps over and stops responding. And so he freaks out and he starts calling out for help. So people uh, called 911, and the paramedics arrived on the scene. When they got to the couple and they checked the girl out, she was pronounced dead on arrival. All right. She had already been dead for the past 10, 15 minutes, whatever time it took for the paramedics to get there. So needless to say, the boy got into a whole lot of trouble, right? He was questioned for as to what was going on and what happened. And he swore that he didn't do anything, and all they were doing was he was just kind of pinching the back of the girl's neck. So then, of course, an autopsy was done, as is the case whenever you have an unexplained, unforeseen, uh, mysterious circumstantial death. You have to do an autopsy. And so that revealed that the girl had died because of cardiac arrest. Okay, cardiac arrest. The heart had stopped beating. So then some history was also collected from her parents and people who knew her, and they found out that the girl was known to have multiple episodes of vasovagal syncope before. So what is vasovagal syncope? Syncope means fainting, losing consciousness. Vasovagal means an overactivation of the vagus nerve to the point where your heart rate slows down so much uh, that it stops pumping enough blood to your brain and you get knocked out. So if you're like in a very emotionally overwhelming situation, people faint. So that is vasovagal syncope. Some people are more sensitive than others. So apparently, unfortunately, this girl uh, was one of those people, and in these circumstances, she was in an emotionally aroused situation, and pinching the back of the neck that can overexcite the vagus reflex at times. So in this case, it was so extreme enough to stop the girl's heart altogether, cardiac arrest. Uh, she went into bradycardia to the point where there was not enough blood being uh, pumped out to her brain, and so she drifted off. She lost consciousness, and eventually she passed away, unfortunately. But these are exceedingly rare, almost unheard of circumstances. So do not freak out if you have vasovagal syncope or those kinds of things. Okay. All right. So now here we are looking at the pelvic splanchnic nerves, and as the name suggests, uh, these ones go down to your pelvic region, right? And so what they do is they cause your pelvic organ vasocongestion, blood flow to the pelvic organs. What would those be? Your urinary tract and your reproductive organs. As you can see here, the penile and clitoral erection. Okay, so more blood flow to your pelvic region. That also happens as a result of stimulation of the parasympathetic nervous system. All right. All right. So which four cranial nerves have a parasympathetic component? Oculomotor nerve, that is cranial nerve number 3, vagus nerve, which is cranial nerve number 10, glossopharyngeal nerve, which is cranial nerve number 9, and facial nerve, which is cranial nerve number 7. What organs are innervated? Oculomotor nerve for the pupil, of course, the eye muscles, facial nerve for the facial muscles, vagus nerve for your viscera in the abdominal cavity, as well as your heart in the thoracic cavity too, and glossopharyngeal nerve for your salivary glands. Okay, facial nerve also does salivary glands here. Uh, and what physiologic response do they cause? They cause an oversecretion of saliva, tear secretion, pupillary constriction, slowing down of the heart rate, and slowing down of the breathing rate as well. What organs are innervated by the pelvic splanchnic nerves? Your genitourinary organs, all right? And they cause vasocongestion, flow of blood, as well as uh, the flow of reproductive fluids from those organs. All right, so here we are looking at the sympathetic nervous system division, its anatomy, where it's exactly located at. So let's go ahead and take a look. uh, here. Okay. So the sympathetic nervous system, again, is all about fight or flight. We talked about that, right? So all of the changes that accompany an emergency situation is what you will see here. It's located in your thoracolumbar region, right? So your thorax and your lumbar region, as you can see. And here is a broad overview of how the sympathetic nervous system affects different parts of the body. So for example, in your facial area, it will cause pupillary dilation now, not constriction, but pupils dilate when you are in a life-threatening situation, as an example. The saliva actually dries out, as do the eyes. The heart speeds up. The respiratory rate increases. So the depth and the volume of air that you're breathing in, both of them increase. Your digestive activities slow down. Adrenaline starts to be secreted from the adrenal glands on top of your kidneys, as you can see here. Your urinary sphincter contracts, so urine is held back. And in the reproductive system, again, the secretion goes down. However, interestingly, ejaculation itself in males is a sympathetic function. Okay, so ejaculation is something that is activated. In your skin, you get goosebumps, the erector pili muscle contracts, and the hairs stand on end. So those are all of the functions uh, and the effects of the sympathetic nervous system that are visible. So here you're looking at an actual cadaver that has been opened up, and you are able to see all of the sympathetic division structures right next to your uh, vertebral canal, your backbone. Here's your vertebral column, and uh, here is the sympathetic trunk. As you can see, it runs right parallel to your spine, as you can see. Okay, these are the sympathetic trunk ganglia, these little swellings and nodules that you see there. Okay, so it runs right next, and that's why it's called a paravertebral division, paravertebral, because it runs right parallel to your vertebral column, to your spine. Okay. So then you also have the white and gray rami, as you can see here in the picture, the gray ramus and the white ramus. Okay. The function, the white rami are like entrance ramps to the trunk. They bring in information from your sensory glands, from your sensory organs back into the sympathetic trunk, right? The gray rami communicantes are exit ramps, so they carry signals through the postganglionic sympathetic axons to the effector organs, which would be your muscles and glands. So you also have sympathetic splanchnic nerves, and they supply the pelvic region, as we saw with the parasympathetic division as well. Okay, you also have prevertebral ganglia, and they're located in front of or anterior to the vertebral column, therefore the name prevertebral ganglia. And these ones include these three: celiac, superior mesenteric, and the inferior mesenteric ganglia. Okay, those are the three. Celiac ganglia is so named because it's found adjacent to the celiac artery, as you can see, and it supplies your digestive organs, which are mentioned here. The superior mesenteric ganglia, again, is adjacent to the superior mesenteric artery, and therefore the name, and it also supplies your digestive organs as well as your kidneys and ureters, parts of your urinary tract as well. The inferior mesenteric ganglia is adjacent to the inferior mesenteric artery, therefore the name, and it supplies mostly your colon, which is your large intestine, rectum, bladder, and your reproductive organs. They get their sympathetic supply from the inferior mesenteric uh, ganglia. So then let's talk about this clinical condition here called the Horner syndrome. And this happens when there is an injury either to your neck region, right? So much so that your sympathetic trunk in the cervical region has been disrupted, or in the thoracic region, okay? And so what do you see in Horner syndrome? Ptosis. Ptosis means your eyelid is like drooping, droopy eyelids, all right? It could be on both sides, bilateral, or it could be unilateral, depending on the type of injury that you've sustained. You also see meiosis, as you see. Meiosis is pupillary constriction. Your pupils constrict. All right, so these are all parasympathetic actions that you're seeing because your sympathetic division has been disrupted here. Anhidrosis, lack of sweating on the affected sides, and also facial flushing because of vasodilation. Okay, that is what Horner syndrome looks like after an injury uh, to the sympathetic trunk. All right, so here we are looking at the different pathways that the sympathetic nerves take to reach your organs. The first one is called the spinal nerve pathway. And you can see why it's called that, because this one runs along with your spinal nerves, as you can see here in this picture. All right. And in this example, uh, these are the preganglionic axons in brown, and those are the postganglionic axons in green, as you can see. Okay. And so this one is supplying your blood vessels and your skin. What is it doing to your blood vessels? Causing vasoconstriction. And what is it doing to your skin? Causing your hair to stand on end by the contraction of the erector pili muscle. So you can see that um, in terms of the spinal nerve pathway, sympathetic nerves. So then you have what is called the postganglionic sympathetic nerve pathway. Postganglionic sympathetic nerve pathway. So here you see the postganglionic axons in green. And so they move on all the way from these ganglia to your organs. In this case, the heart. What are they going to do to your heart? They're going to speed it up. They're going to speed up the heart, and they're going to enhance the strength of the heart in pumping out blood, because this again is sympathetic, fight or flight, right? Then you have the splanchnic nerve pathway, and here's an example of the splanchnic nerve pathway. It's called that because it runs within the splanchnic nerves. Here are the splanchnic nerves, and so the fibers are running along with the splanchnic nerve. This one is supplying your intestine. And what is it going to do there? It's going to stop your intestinal motility, movement of the intestine, making you constipated, and also dry out the intestines to prevent digestion. And finally, the sympathetic pathway of the adrenal medulla. And this is the simplest one, adrenal medullary pathway. Here, one long nerve, sympathetic nerve that is runs from your spinal cord along with the splanchnic nerve and goes directly without synapsing anywhere to your adrenal medulla, which is this gland, the adrenal gland on top of the kidneys. By stimulating the adrenal medulla, it is ensuring the secretion of adrenaline from here. And adrenaline is your primary fight or flight hormone. Okay. So what is the difference between sympathetic trunk ganglia and the prevertebral ganglia? The location, the sympathetic trunk ganglia are right next to your vertebral column. The prevertebral ganglia are in front of the vertebral column. What are the structural and functional differences between the white and gray rami communicantes? White ones are the entrance ramps. They bring in information. The gray ones are the exit ramps. They take away information. How do the spinal nerve and splanchnic nerve sympathetic pathways differ? The spinal nerve sympathetic pathway goes along with the spinal nerves, and the splanchnic nerve sympathetic pathways go along with the splanchnic nerves. Okay. In what ways does the adrenal medulla pathway help prolong the effects of the sympathetic stimulation? Because once you stimulate the adrenal medulla, it responds by secreting adrenaline, and adrenaline keeps you in a state of fight or flight for up to 15 minutes, 15 minutes to about half an hour, depending on your metabolism. So it is prolonging the effects of the sympathetic stimulation. All right, so here we are looking at some other autonomic nerve plexuses found within your thoracic and abdominal pelvic cavities. The cardiac plexus, as the name suggests, it sends both parasympathetic and sympathetic nerves to your heart. The parasympathetic ones will slow down the heart. The sympathetic ones will speed it up. Pulmonary plexus, pulmonary means lungs. So this sends both sympathetic and parasympathetic nerves to your lungs. The parasympathetic ones will cause bronchoconstriction. The lungs will shut down. The breathing will go down, the breathing function, while the sympathetic ones will cause bronchodilation. The lungs will open up and you will be able to take in more air. Then the esophageal plexus, it sends sympathetic and parasympathetic branches to your esophagus. Sympathetic ones will inhibit digestion and motility there. The parasympathetic ones will enhance motility and digestion. Abdominal aortic plexus, right? So that consists of all these three ones: celiac, superior mesenteric, and inferior mesenteric plexuses, and they supply the organs of your digestive organs, basically your intestines, your urinary tract, and your genital organs. All right. And then, of course, the hypogastric plexus here as well, which supplies your hypogastric region, which is again your pelvic viscera. All right. So here in this picture, you can look at the different autonomic plexuses, the cardiac plexus next to the heart, pulmonary plexus to the lungs, esophageal plexus to the esophagus, uh, celiac plexus right next to the stomach, superior mesenteric, inferior mesenteric, and then the hypogastric plexus. So these are some of the plexuses to remember, nerve plexuses for your autonomic nervous system. So also remember that you have something called the enteric nervous system, And this enteric means your intestines. So this nervous system is found within the intestinal walls themselves. It includes two large ones, as you see here, submucosal and myenteric plexus. What does the submucosal plexus do? It enhances, increases, or decreases your intestinal juices secretion. How about the myenteric plexus? It either increases your intestinal motility or peristalsis, or it decreases it, okay? So again, parasympathetic stimulation will cause your submucosal plexus to secrete digestive juices and your myenteric plexus to enhance or speed up your intestinal movements. Sympathetic stimulation will cause your submucosal plexus to dry out, to stop secreting digestive juices, and your myenteric plexus to go into constipation, stop the motility of the intestines, because fight or flight is not the best time to go and take a dump or take a leak or something like that, right? So what basic structures form an autonomic plexus? Both sympathetic and parasympathetic nerves. Where is the enteric nervous system located? Within the walls of your intestines. What is their function? Depending on whether it's sympathetic or parasympathetic, it either enhances digestion or it reduces the digestive function. All right, so here we are looking at some of the neurotransmitters that are involved in your autonomic nervous system action, right? And the two big ones that you see here are acetylcholine and norepinephrine, as you can see, okay? All right, so how do these two types of neurotransmitters work all across your autonomic nervous system? So let's take a look at the parasympathetic nervous system in orange. The sympathetic ones are here, pathways are on the right-hand side. So for the parasympathetic nervous system, look, acetylcholine is first secreted at the preganglionic level, here, right? And even at the postganglionic level, you also have acetylcholine. So acetylcholine is the primary neurotransmitter, both at a preganglionic and a postganglionic level in the parasympathetic pathways. How about the sympathetic pathways? Well, uh, so in the preganglionic region, all three have acetylcholine as a neurotransmitter as well, you can see. In the postganglionic region, you can have either acetylcholine, or you can also have norepinephrine, such as in this case, adrenaline, all right? Okay, so much for the neurotransmitters. How about the receptors for those neurotransmitters? So in the parasympathetic pathways, you have what are called nicotinic receptors in the ganglion, right? And then here in the postganglionic pathway, that your target cell organs have muscarinic receptors. So both nicotinic and muscarinic receptors are there for binding to acetylcholine. All right. What does that name sound like? Nicotinic. Nicotine. Nicotine is the primary stimulant in tobacco, cigarette smoke, as an example. So how does it stimulate you? Why do people crave that rush that they get from smoking tobacco, from getting nicotine? Because that nicotine stimulates both their preganglionic and their postganglionic receptors, thereby making them feel more alert, more active. Their skeletal muscles work better, and that's the rush that they're looking for. All right. Again, in sympathetic pathways, again, you have nicotinic receptors without any exception in all the in all of the preganglionic regions, right? In the postganglionic regions, you have either muscarinic receptors. For example, if you're talking about sweat glands have muscarinic receptors that respond to acetylcholine. If you're talking about most of the body structures, right, your organs, uh, heart, liver, brain, lungs, whatever, then the postganglionic target cells actually have adrenergic receptors, and therefore they respond to adrenaline, therefore the name. So that's why adrenaline or norepinephrine, same thing, is being secreted here for the adrenergic receptors. And in the case of the adrenal medulla pathway, again, you have nicotinic receptors on the adrenal glands here. So the only exception seems to be this one, the adrenergic receptors for sympathetic stimulation found on your digestive organs. That's the rest of them all have muscarinic receptors in the postganglionic region. And all of them have nicotinic receptors in the preganglionic region. You can see that here. All right, so nicotine and muscarine, two types of receptors, two types of substances that respond to acetylcholine, okay? Now, moving on from nicotinic and muscarinic receptors, let's move on to the noradrenergic or adrenergic receptors, which are of two types, alpha and beta receptors, okay? And among those alpha and beta receptors, for the adrenergic receptors, you have two types: alpha 1 receptors, which are mostly found in your blood vessels, your goosebump muscles in the uterus, and also in your uh, urinary tract and dilator pupillae muscle, and alpha 2 receptors, which are basically found in your GI tract, in your intestines, in your gut. All right. So those two types, alpha 1 versus alpha 2. How about the beta receptors? They are divided into three types, subtypes rather: beta 1, beta 2, and beta 3 adrenergic receptors. The beta 1 receptors are primarily found on your heart, okay, and kidneys. Beta 2 receptors are primarily found on your lungs, also in the uterus and your GI tract, your digestive organs. And beta 3 receptors are basically found in your adipose or fat tissue. Okay. So now here I will like to take a pause and talk about a quite a remarkable medical incident that I came across, and that has to do with these two types of receptors, beta 1 versus beta 2 receptors. So this was the case of a 55-year-old overweight smoker, hypertensive patient who also had a long-standing history of asthma. Okay, so this guy came in to see a primary care doctor for his blood pressure, for his hypertension, right? Uh, and so again, say 55-year-old obese, hypertensive, uh, asthmatic patient and propranolol. Right. So what happened with this patient was the doctor did his initial workup and he found out, well, of course, the patient is hypertensive, he's obese, he's overweight, not doesn't get much uh, exercise, also a smoker. Uh, so what he did was the doctor went ahead and prescribed propranolol, a beta blocker drug called propranolol to him. Now, propranolol is what is classified as a non-selective beta blocker. Okay, what does that mean? That means it does not differentiate between your beta 1 and your beta 2 receptors. Okay, so in other words, when the patient took those pills, propranolol, uh, his beta 1 and beta 2 receptors both got blocked off, right? Which was good for his condition, for his hypertension, because his heart started beating a little slower, his blood vessels vasodilated a little bit more, and so this this beta blocking effect brought down his blood pressure, which was indeed the desired effect. However, somehow the doctor failed to pay attention to his long history of chronic asthma, right? So the drug was also blocking the beta 2 receptors, and the beta 2 receptors are primarily found on your lungs. And when you block those beta 2 receptors, which cause bronchodilation, what do you get? Bronchoconstriction, the lungs collapse. Needless to say, after 48 hours, the patient came back to the hospital, only this time not to the outpatient department, but to the ER, because this patient was having a severe asthma attack called status asthmaticus. Status asthmaticus is an exaggerated, strong, and occasionally fatal, frequently fatal asthma attack. Millions of people, even to this day, actually die because of status asthmaticus. And in spite of the doctor's best attempts, unfortunately, they were unable to save this patient's life. He passed away because of that severe asthma attack. And guess what? When they went back and at autopsy and checked the patient's medical records and everything, the doctor in question, they pressed criminal charges against him. He ended up losing his license. Okay, just a small matter of paying attention, or rather not paying attention to the patient's history carefully. Okay, now the answer could have been just as simple as, instead of propranolol, just prescribe something like atenolol to the patient. And an atenolol is a beta 1 selective beta blocker, right? It's beta 1 selective, which means it causes your heart to slow down and your blood pressure to go down, but it does not affect your lungs. It does not block uh, your lungs and cause bronchoconstriction. Just a small slip, right? Instead of atenolol, propranolol, and somebody lost their lives. So hopefully that'll help you remember what that is. So that's what we're looking at here next, the treatment of asthma. So asthma is a respiratory disorder where your smooth muscles of your respiratory tract hyperreact to allergens or pollen or temperature changes, even stress, any kinds of things. And so bronchoconstriction, they shut down, the lungs collapse onto themselves. And therefore these patients have wheezing, difficulty breathing. It's a like an obstructive disease. It's a type of a COPD, chronic obstructive pulmonary disease. Okay. Um, and so how do you treat it? You give them epinephrine or adrenaline, because adrenaline is something that will excite the beta 2 receptors, causing the lungs to open up. In fact, even coffee, because coffee also has a secondary adrenergic effect. Coffee will help in these severe asthma attacks too by causing bronchodilation. Okay. And then, of course, you need inhalers like albuterol, which is a beta 1 agonist. All right. Beta 2 agonist. Again, I don't want to make that mistake again. Beta 2 agonist. That's what it is. Albuterol. And so those are the inhalers that are prescribed. Beta 2 agonist, albuterol, or a drug called ipratropium as well, which is an uh, anticholinergic. It prevents acetylcholine from acting there, anticholinergic, therefore causing your lungs to open up again. So which autonomic nervous system neurons are cholinergic? All of the preganglionic axons and most of the postganglionic axons as well, with the exception of the adrenergic ones. Which ones are adrenergic? The sympathetic postganglionic axons. Where are nicotinic and muscarinic receptors each located? The nicotinic ones on the preganglionic axons in the parasympathetic nerve fibers and most of the sympathetic nerve fibers, and the muscarinic ones in the postganglionic axons. That's where you find them. When a neurotransmitter binds to a nicotinic effector, is the effect excitatory or inhibitory? Anyone who has ever smoked will tell you that it's excitatory. Nicotine excites. What are the different types of catecholamines? Adrenaline and noradrenaline, also called epinephrine or norepinephrine. Okay. How is it possible for the stimulation of adrenergic receptors to result in either vasoconstriction or vasodilation? Okay, so that depends on uh, what type of an organ is involved. For example, under adrenergic stimulation, your fight or flight response, the blood vessels supplying your skin, they vasoconstrict. They divert blood away from your skin. But the blood vessels or arteries supplying your muscles, your heart, your brain, your liver, they vasodilate. So more blood can flow to your muscles and your eyes and your heart and brain so you can take necessary action. So it depends on the end organ. Autonomic tone or vasomotor tone, as you can see, this is a baseline discharge of your sympathetic nervous system, which keeps your blood vessels mildly contracted so your blood pressure doesn't drop drastically to a dangerous level. Even while you're asleep, even though your blood pressure drops significantly, but there's still some autonomic vasomotor basic tone, baseline tone there to keep the blood pumping throughout your system. All right, that's what it is. Dual innervation, which means organs that receive both sympathetic and parasympathetic divisions, right? And usually they have antagonistic effects. Sympathetic and parasympathetic effects are opposite. One is rest and digest, the other one is fight or flight, such as in your heart rate, right? Sympathetic stimulation will speed up the heart, parasympathetic stimulation will slow down the heart. Same with your GI tract and your digestive organs. Parasympathetic stimulation will increase the secretions and digestive process. The sympathetic stimulation will decrease the digestive process. Pupils of the eyes, sympathetic nervous stimulation will cause pupillary dilation, something called mydriasis, and parasympathetic stimulation will cause pupillary constriction, something also called meiosis. However, there are some places where both parasympathetic and sympathetic nervous system function is needed to accomplish that, such as the male sexual function. So in males, erection is a parasympathetic effect. To get an erection successfully, you need to be relaxed in a rest and digest, peaceful state. All right. The way your book puts it is, remember, point and shoot. All right. Point and shoot. So obviously here, point is referring to erection and shoot is referring to ejaculation, right? So point starts with the letter P. And you can think of that P for parasympathetic stimulation, right? Parasympathetic stimulation. So pointing or getting an erection is a parasympathetic rest and digest phenomenon. Shoot starts with the letter S, and that letter S is for sympathetic stimulation. In other words, ejaculation is something that needs your sympathetic nervous system to accomplish, okay? So both of them work together, erection and ejaculation, in order to successfully accomplish the male sexual function, as we see here, okay? Raynaud syndrome, I talked about it before. My wife is a partial sufferer. So when due to exposure to cold or certain emotional conditions, the small arterioles in your digits and your fingers and your toes constrict. This might cause like pain and your nails turn blue or purple and like this pins and needles sensation. It's kind of uncomfortable, right? This is an exaggerated local sympathetic response. The treatment is nothing more serious than just immersing your digits in lukewarm water and giving it some time. All right. So how does autonomic tone permit the control of blood vessel diameter by sympathetic innervation? The sympathetic innervation ensures that your blood vessels are always a little constricted, vasoconstricted, so the blood pressure is maintained, and that is needed to perfuse and supply blood to all the organs of the body, even while you're asleep. What are the antagonistic effects of the sympathetic and parasympathetic divisions on the heart? The sympathetic nervous stimulation will speed up the heart, increase cardiac output. Parasympathetic stimulation will decrease cardiac output, okay, and the heart rate. How do the sympathetic and parasympathetic divisions exhibit cooperative effects on the male reproductive system? Point and shoot. Erection is parasympathetic, ejaculation is sympathetic. What are the body structures uh, innervated by the sympathetic division only? So it's like your sweat glands, the erector pili muscle, your goosebump muscles, and the adrenal medulla. They only have sympathetic division and no parasympathetic stimulation involved there. How does the cardiovascular reflex affect blood pressure? When the heart rate goes up, blood pressure increases. When the heart rate goes down, blood pressure decreases. All right. Okay, so autonomic reflexes like your cardiovascular reflex again. Um, So when there's too much blood pressure, stretch receptors are stimulated. They send signals to your cardiac center, which is in your brainstem in a region called the medulla oblongata. We talked about that before too. It inhibits the sympathetic stimulation. The heart rate goes down. Gastrointestinal reflex or the defecation reflex, when your rectum fills up with fecal matter, these stretch signals are sent to the brain, again to the brainstem, and then the motor neurons bring the signal back to cause a relaxation of your internal anal sphincter so you can pass out the fecal matter. Same with the micturition reflex, which is for urination. When your urinary bladder stretches up with urine, stretch receptors send the signal back to your spine, your spinal cord, and the spinal cord sends back the signal for your urinary sphincters to relax so the child can urinate. Or again, my construction worker patient, it can happen to adults too if you suffer a spinal shock or a spinal concussion. So here in this picture, you can see the urinary bladder is filling up with urine, right? So the stretch is being felt in your spinal cord and by the sensory neuron, and then the autonomic motor neurons again from the lateral horn go down to your sphincter and cause relaxation of the urinary sphincter so you can pass the urine, all right? Autonomic dysreflexia. This is something that might cause your blood pressure to rise dramatically and dangerously at times, right? A large increase in blood pressure because of a stimulation, hyperstimulation of your autonomic nervous system, the sympathetic division after a spinal cord injury, okay? So initially there's spinal shock, loss of all autonomic reflexes like erection or defecation or urination. And then afterwards, an abnormal response, something called denervation hypersensitivity, right? Involuntary relaxation of the urethral sphincter. So you soil your pants or you wet your pants without intending to. This all could be related back to your spinal injury. How does the cardiovascular reflex affect blood pressure? It controls it like by negative feedback. Bring it down if it's too high and bring it back up if it's too low. All right, end of chapter 15. We are almost done with our semester. One more chapter to go, 16. I'm going to share that with you on Monday, hopefully. You have all the study guides, so keep preparing for the exams. Let me know if you have any questions, comments, suggestions, feedback, and enjoy the rest of your day. Have a wonderful evening. Stay safe, and I'll see you all virtually again by means of my lecture presentation on Monday. Bye-bye.